Hey everybody, this is Matt at Ask a Prosthetist. Today I have a cat that won't let me stand up or move, so say hi, Twink. No, not so much. Okay, anyways, so today I'd like to talk about a question that I got regarding liner materials. So just as a reminder, all things that I say here are my opinion and mine alone. I'm not getting any medical advice out to anybody. I'm just answering questions and hoping that I can be helpful. So this is Ask a Prosthetist. So today's question is, how do you decide what type of liner material you're going to use for a patient? So the most common, and I think if I'm not mistaken, the first type developed were thermoplastic elastomer, or TPE. TPE is a very, very soft gel that is mostly used on patients who are going into suction systems, sometimes vacuum systems. Its main property is that it flows a lot. It has a very low durometer, so it's great for people who have really sensitive limbs. If you have diabetic patients that you're trying to prevent from getting any types of wounds. So TPE is the main go-to that a lot of people use. It's inexpensive to make. They can make custom liners. There's one custom liner company that does TPE liners. The second type that's out there is silicone. Silicone is a much more durable type of gel. It is a higher durometer, so it doesn't pack out quite as badly as TPE does. TPE tends to wear out a little bit faster if you have a more active patient. Silicone is very good for locking type liners because it helps prevent a lot of limb elongation in the socket. They always tend to have a matrix in them, so the matrix also helps prevent elongation of the limb, but a lot of TPE gel types have a problem with pistoning because of the elongation, despite the matrix that they put in the liners. A matrix is basically a type of fabric or material that's woven into the liner to prevent distal elongation. So silicone I don't typically see used in vacuum systems. You sometimes see it used in suction systems, but I haven't really had a lot of success with patient comfort in that. So I tend to use softer gels in suction type systems. So again, to wrap it up, silicone, great for pin systems, great for strap systems. Very durable compared to its TPE cousin, which brings us to the next type, which is a hybrid liner. So hybrid liners are a mixture of silicone gel and TPE gel. It tends not to be as durable as silicone, but it is a lot softer. So if you have a patient that needs a little bit more durability, but they still need the softness, I would tend more towards the hybrid type gels. They work very well for their purpose. You can use them in either pin systems or mechanical suspension, I guess, or you can use them in suction systems, vacuum systems. So they're kind of a jack of all trades, but really a master at none. There is a type of liner that is a duo liner, where they put thermoplastic elastomer on the inside of the gel liner, so that's touching the patient's skin. They also and then they also use the silicone as an outer layer to increase durability. Does it really do what it says it does? Kind of. I've only seen them used in suction type liners or vacuum liners. In my experience, they tend to wear out after about 6 months. The nice thing about them is they're usually a symmetrical profile so that you can rotate them and that helps prolong their life. But again, that's kind of a specialty type of liner. Now, the last type of liner material is very interesting. It's called urethane, and it's only made by one company that I know of. Urethane liners are best used in vacuum or suction suspension. Using them as a pin system is very, very rare. There are some practitioners that swear by it, but you can only do it in a custom liner form, and they have to do a lot of special things to it to make it work. So I don't think I would ever use them in a mechanical suspension system, but there's some people who swear by it. Anyways, so properties of urethane. Urethane has incredible flow to it, meaning that when the patient dons the socket, the gel flows away from areas of pressure and into softer areas. So it actually enhances your suspension of the limb inside of the socket by floating the limb in this gel. It's pretty cool. It has one issue though. If you don't follow the proper modification techniques, the gel can crack from the inside. Another thing is, I would never, ever use it with a fabric outer layer, because it hinders the gel's ability to flow, which can cause a lot of problems because it keeps it from doing what it's supposed to do. So there's only one company that I know of, like I said, that makes them. And I've had great experiences with them because you can do a 3D profile where you put gel on areas that need it and keep gel off of areas that don't. So I'm actually putting a patient in one now that's going to be a custom one. So when we talk about the durometer of the different liners, basically the durometer test is where you take a weighted pin and you drop it down into the gel and see how far down it goes into the gel. So if I were to go from most dense to least dense, it would start at silicone, hybrid, TPE, and then your urethane. Urethane, if you put a pin through it, it'll basically drop until it goes all the way through the liner. That's how soft the material is. So it's incredible for vacuum systems, great for suction systems. Pin mechanical suspension, not so much, in my opinion. So anyways, a little bit longer video today, but I hope you got some good information out of this. As always, if you have any questions for me, please send them to askaprosthetist@gmail.com and we'll try and address them. Please leave a like, subscribe, comment. I like to hear comments and see what people think so that I can do things better. So say goodbye, kitty. No, not so much. All right. You're just going to lay there and be a kitty cat? Is that what you're going to do? Okay. Fine. Be that way. Well, God bless and take care, folks.